Hey guys, my name is Kyle. I am co-director of Los Santos County Department of Public Safety. Outside of the community, I'm a nationally registered EMT paramedic, as well as a certified critical care paramedic and a BLS CPR and AED instructor. I have roughly a decade of experience in 911 fire and EMS, and I have also spent over 5 years working in critical care flight medicine. Today we're going to be going over the basics of CPR and AED usage. This information is all based on real standards and is potentially a life-saving tool, whether applied to your in-game roleplay or if used in real life. Okay, so what is CPR? CPR is defined as cardiopulmonary resuscitation, which is an emergency procedure that combines chest compression with artificial ventilation in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. So what does that mean? To put it all more simply, CPR is the procedure of circulating blood around the body of someone whose heart is not beating. This is done by performing what is called a chest compression, which we'll discuss in a moment. In addition to these chest compressions, CPR also involves breathing for the person who is not breathing on their own. This can be done simply through mouth to mouth or by using a specialized device to breathe for the patient. So, why do we do CPR? When a person's heart is no longer beating, they have a short matter of minutes, less than 10, before their brain begins to die from lack of oxygen. This death is permanent and cannot be undone. The person's heart needs to be restarted either through the use of a defibrillator, emergency medications, or other advanced medical procedures. But until those procedures can be carried out, say by arriving paramedics, you will need to keep the oxygen-carrying blood, which is already in the person's body, circulating around and around to prevent this brain death while you're awaiting advanced medical care. Now, CPR is the means of keeping blood flowing until a person's heartbeat is restored. It is not the cure or the means of restarting the heart. It is just a way of buying time until this can be done. However, it is crucially important to successfully reviving someone. Without CPR, they will not survive. Okay, so first let's discuss when to and when not to perform CPR. For this scenario, we're going to pretend that you've been called to the scene of a person who is reportedly not breathing and without a pulse. Let's discuss situations where you would and would not begin CPR. Now, there are situations that you definitely do not want to start CPR on someone who is without a heartbeat. These are situations where no amount of attempted resuscitation is going to revive the person. Some examples of these situations would be decapitation, as you can see there, injuries not compatible with life, such as massive trauma and deformity, any obviously extended amount of time that they've been without a pulse. This will be obvious if you go to touch the patient and they are rigid, which is known as rigor mortis, or if obvious decomposition of the body is present. None of these situations are compatible with resuscitation, and CPR should not be attempted. As always, use your best judgment and common sense. If it's obvious that the person is beyond saving, then do not start CPR. Alright, so assuming the person you are called to is a viable candidate for receiving CPR, let's discuss the first things you do when you arrive on the scene. As always, scene safety and protective clothing and gloves are extremely important. Do not enter any scene without observing it first for potential dangers, and make sure you are wearing gloves and other protective items before touching any patient. Once that is out of the way, proceed to find your patient, make sure to determine if there is more than one patient on the scene, and call for additional resources as needed. Once you approach your patient, the first thing you want to do is determine what is called their level of consciousness. This means how responsive, if at all, the person is to you. If you say, "Hello, how are you?" and the patient responds to you, then obviously they have a pulse and they are breathing and they do not need CPR. Now, if the person does not respond to you at all, you'll need to check for a pulse. To do this, take the index and middle finger of your hand and place them together on the side of the patient's neck, as shown here. I recommend you try practicing this on yourself in real life, as it's the best way to learn how to check for a pulse. Now, we always check for a pulse for about 10 seconds. If you feel a pulse, then do not start CPR, and if you're not a paramedic, then await additional help. If you do not feel a pulse, then we need to go ahead and get CPR started. Place the patient flatly on their back, then interlock your hands as shown here, and place them on the patient's chest. The heel of your palm should be resting on the patient's sternum. This is a hard bone surface typically found between the patient's nipples. Once you've done this, you'll begin CPR by pushing down hard. You should be pushing about an inch onto the patient's chest. Don't be afraid to hurt them. They need good CPR, and this means pushing down effectively to get the blood flowing. Now, you want to push down on their chest at a rate of about 100 chest compressions per minute. Obviously, that is more than 1 per second. This is an intense and physically demanding experience, so be ready to keep CPR going for some time without relief. The following video will give you an idea of what it looks like to perform effective CPR.
In this video, I'm going to demonstrate how to administer CPR on an adult. Okay, suppose you find someone lying down on the floor. What are you going to do? First, assess the scene. Look around. Make sure the scene is safe. Are there safety hazards? A chemical spill? Electrical wires? Gas fumes or anything dangerous? You can't help anyone if you become a victim too. If the scene is safe, check the person for a response. Tap or shake the victim on the shoulder and shout, "Are you okay?" If you do not get a response from the victim, yell for help. Next, tell a specific bystander to phone 911 or the emergency response number and get an AED, and very importantly, to come back to help. Many facilities, stores, schools, airports, conventions, and sports arenas will have AEDs available. Now check for a pulse. To locate a carotid pulse on an adult or child, place your 2 fingers on the center of the victim's neck. Slide your fingers down the side of the neck into the notch between the muscles. You should feel a strong pulse there. Let me show you how to do this. First, if possible, remove clothing out of the way of the victim's chest. Next, locate your hand placement for compressions. With your hand, draw a line from armpit to center of chest for placement. Place the heel of one hand on the lower half of the sternum or breastbone. Now, place your other hand over the first, interlacing your fingers for support. With your arms straight and your shoulders positioned over the victim's chest, push down on the victim's chest. For an adult, you will want to push down at least 2 inches or 5 centimeters. Now watch as I perform 30 deep compressions in 18 seconds or less. You want to be able to give at least 100 compressions in a minute. You may lift your hand slightly off the chest between compressions to allow for full chest recoil. But keep your hand placement. Keep interruptions to a minimum. It helps to count out loud. Some say humming the tune to the 1980s pop tune "Stayin' Alive" is good for keeping the right tempo. I'll give 30 compressions in 18 seconds or less, counting out loud to 30. After 30 compressions, give 2 breaths.
Okay, that's about enough of that woman. Moving on. Alright, So let's talk about AEDs. AED stands for Automated External Defibrillator. Now you can read the definition of an AED below, but simply put, an AED is a device that when properly placed on a patient will automatically determine if the patient is in a dangerous heart rhythm that can be shocked using a specific dose of electricity back into a normal heartbeat producing rhythm. One way to think about how an AED works is to imagine it like the power button on your computer after a blue screen. It is used to restart it back to normal function. Now, not all patients that have no pulse will be in a heart rhythm that can be fixed with an AED. The AED will determine that for you and tell you whether or not a shock is advised. The following video is a demonstration of the usage of the automated external defibrillator.
What should you do if you see someone collapse who is not responsive? You know to call 911 and do continuous chest compression CPR. But what if you're in a place where an automated external defibrillator or AED is available? The availability and prompt use of an AED have been shown to save people's lives from sudden cardiac arrest. Using the AED is fail-proof. Just turn it on and follow the instructions. The voice prompts will walk you through each step.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Oh, we don't need that. Okay.
When patient's chest is bare, remove protective cover and take out. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. Press firmly to patient.
Note that one electrode pad is placed just below the right clavicle and the other on the left side, just below the level of the breast. If a straight line were drawn between the two electrodes, it would pass through the center of the heart. The electrodes will analyze whether a shock is necessary.
Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button. Shock delivered.
Regardless of whether or not the AED delivers a shock, resume chest compressions until paramedics arrive.
Be sure emergency medical services have been called.
Alright, that was the usage of an AED or automated external defibrillator. The last thing that we're going to talk about as part of CPR and AED training is the delivering of artificial ventilation or breathing for the patient that is not breathing on their own. Now, if there's only one responder on scene, that responder will perform CPR until additional help is arriving and should not perform any other procedures such as the AED or artificial breathing. Once additional responders have arrived on scene, the second arriving responder can place the AED device on the patient and use it as instructed. In addition to this, they can begin providing artificial ventilation, otherwise known as breathing for the patient, using one of several different devices or procedures. The first way that a responder can breathe for the patient would be to perform what is called mouth-to-mouth. As a professional first responder, you will not be expected to perform mouth-to-mouth in the field. You will be provided with the necessary equipment needed to more safely provide artificial breaths to the patient. The device that you'll use to provide these breaths for the patient is called a bag valve mask, or BVM. Now, law enforcement responders in our roleplay community will not be equipped with this device. They'll be equipped with a simple face mask, which they will place on the patient's mouth. The use of the face mask for delivering of breaths by law enforcement first responders involves the first responder performing CPR while the second responder places the face mask over the patient's mouth as illustrated. The first responder will perform CPR for 30 compressions before stopping and allowing the second responder to deliver 2 breaths through the face mask. Place your mouth on the end of the face mask, as shown in the illustration, and deliver 2 full breaths before the first responder will resume CPR. Alright, so for those of you in fire and EMS, you will not be using the face mask device when performing CPR on a patient. You have access to what is called a bag valve mask, which is a more advanced device used to deliver controlled artificial breaths to the patient. The bag valve mask is similar to the face mask and includes a face mask in the device. It also attaches a bag to the end of the face mask, which we will use to deliver the breaths. You'll place the face mask on the patient in the same fashion that the normal face mask is placed. Maintain a tight seal on their face by pressing down with your hands in a C shape on the patient's face. It's important to maintain a good seal to ensure that the breaths are effectively delivered. When the mask is on the patient's face, take one hand, place it on the bag portion of the bag valve mask, and squeeze about halfway down on the bag, nice and slowly, and deliver 1 effective breath. You'll do this the same fashion that you use the face mask for and deliver 2 ventilations for every 30 chest compressions during CPR. Now that'll conclude CPR and AED training. If you have any questions, contact your supervisor or department head. And as always, I can be reached by private message if you have any questions directly about this material. You will have a quiz on the CPR and AED course, and you can study this video and the associated PowerPoint presentations, but you cannot use this material during your quiz.